Hello, everyone. Welcome. My name is Tiffany Palino. I am one of the tutors here at Archer. I'm also the manager of pre-licensure and continuing education services, as well as certifications. So I'm really happy to be here with you all today. Shout out to everyone on Facebook or YouTube watching, and then anyone here on Zoom. So, today we're going to be reviewing critical thinking. So, specifically talking about those entrance exams. So, your HESI A2 or your TEAS 7. I know specifically HESI A2, sometimes if your nursing school requires, they're going to have a critical thinking section. So, I'm going to kind of get into what that means. So, before I begin, a little bit more about myself. I've been a nurse now over 16 years. I've been an educator over 5 years. I've worked all over the place, and all over the country. So, I've been in your shoes once before, and I know it can be tough, but with a little bit of practice, I think we can get there. So, maybe you're wondering, what is critical thinking? So, critical thinking is defined as analyzing data, recognizing priorities, and making safe decisions. So, really, what that means is let's talk about each one. Analyzing data. That's looking beyond the obvious and understanding anything underlying, any kind of underlying information. So, you kind of analyze whatever's in the question. Recognizing priorities. So we have to determine what needs critical attention first, or what needs attention, what is a crucial. Lastly, making safe decisions. So our goal as nurses is always to be safe, and it's always to ensure safety of and well-being of our patients. So that's why critical thinking is sometimes tested during our entrance exams, because these are the critical skills you need as a nurse. So think about how these play a role in your daily practice in nursing, in clinicals, in practice, or again in pre-nursing, thinking about sciences, right? That you're taking science classes and how it really all comes together in the end. So, specifically talking about the HESI, they have these 5 points. It evaluates, so what I mean by that is the critical thinking section is really evaluating these 5 points. So, first, problem solving. What is problem solving? It is involving identifying the problem and figuring out the best approach to resolve it. So, problem solving, making sure we choose the right answer, right? We do the right thing. Next is recognizing bias. So this helps ensure your decision is based on facts, not on opinion or perceived notions. Third is deductive reasoning. This is all about drawing logical conclusions from whatever information is available. Fourth is argument analysis. This is evaluating the validity of different arguments and being able to support your conclusions effectively. So, what does that mean? So, is this true? And do I have information to back it up? That's how I want you to think of argument analysis. And then finally, decision making. It's all about making an informed and safe decision and making it quickly and confidently, because it's all about patient safety. And so that really is the key. These skills I mentioned here, it's for the HESI because I'm specifically talking about when the HESI entrance exam has this topic as part of their entrance exam. These are the components they're looking for. But look, these are important and being any nurse. They're also important when you're taking the NCLEX and you're doing that critical thinking every time you're answering a question. So, these are just key things to think about when you're answering these questions and when you're critically thinking. So, what do these questions look like? Remember, they come in the form of kind of short scenarios. So, it might just be a sentence or two, but just kind of giving you a little bit of a scenario. I want you to think of every question like a mini patient scenario, so it really can help you critically think. Much like you would in the real world, right? In the real world, if you're in clinical or at the hospital, this is how you think of these little situations. And then finally, it's really guiding you to think like a nurse, even before you start nursing school, right? So assessing the situation quickly, efficiently, and then prioritizing what the patient needs, just like you would when you become a nurse. So, what I want you to do as we go through, we're going to go through a couple examples here. I want you to take a moment in each scenario. Put yourself in the nurse's shoes, okay? Pretend like you're the nurse and think about what you think is the best thing you should do. So, consider the patient's immediate condition and the potential outcomes for whatever decision you decide to make. Our aim is really to cultivate the ability to swiftly recognize critical situations and respond. That's what it is about being a nurse, right? The call bell goes off or the bed alarm goes off, and where do we run to? Why do we run there? So we want to make sure our patient doesn't fall, right? It comes all about safety. So a lot of this stuff is really second nature. So let's go through a scenario and kind of see what we think. Practice question number one. So this is quite simple. So it's written as such, but it's really simple just to kind of see who do you think you're going to see first out of these two patients. So you have patient A. They're post-op or post-operative, meaning they just had surgery. Their blood pressure is 88 over 50 and they are pale. Patient B is a diabetic and they're requesting their lunch tray. Any ideas? Who do you think we should see first? I'm going to give you a moment to think about it, but who do you think we should see first? Who should we see first? Any ideas? You can type it in the chat. All right, if you guessed patient A, you are absolutely correct. Patient A is someone we need to see first because that low blood pressure. Why? Why is that so important? Very good if you guessed A in the chat. Um, so understanding the severity of the symptoms is key here. What does it mean when someone has low blood pressure? That means there's not enough blood flowing, right? It's not going through the heart, it's not going to the essential organs, and it could indicate possible shock. Pallor means pale skin, right? So they might be experiencing shock, so we really should see them first. On here, it says ABCs, which means airway, breathing, circulation. This is a test taking strategy that you can use even in the NCLEX, even in nursing school and beyond. So we're thinking about the patient's airway, the breathing, and their circulation. This seems like a circulation problem because their blood pressure is low. So we really want to address this first before addressing anything else. It's important to think like a nurse here and prioritize anything that it would be related to patient safety. Now, the other client or the other patient really just wanted their lunch tray and they're a diabetic. That's important to go check with them to see what their blood sugar is, but the blood pressure of patient A really is first. Any questions about that? Please let me know in the chat. Okay, next we have practice question number two, a little bit different because this one is a multiple choice. So, a nursing student sees another student give a medication without verifying the patient's ID band, which what that means is every patient wears an ID band and it has their name, their date of birth, has a medical record number, and it could have other things on it. But basically, it's important to check that. So, what is the most appropriate response? What should this student do? Should they A, ignore it, B, report it later, C, correct it immediately, ensure safety, or D, wait for the instructor? Any thoughts? Good. If you guess C, you're absolutely correct. This is a safety issue. We have to focus on safety here. Safety, safety, safety. In this scenario, when we see another student administer medication without doing this, it's really crucial that we act immediately because what could happen? It could be the wrong medication, the wrong patient, and the only way to determine that is if we kind of step in. Um, we're going to not only protect our patient here, but we're also going to model what we call accountability and advocacy. So we're going to advocate for our patient. This is super important in professional nursing practice. Accountability and advocacy. After ensuring safety of the patient, it's really important to do what next? Who are we going to notify next? So the patient's okay. We stepped in right away. And then who do you think we're going to notify next? If I was the student nurse, I would probably go ahead and notify my instructor next because they need to know. And then we need to know that there's something, we're missing something, right? Maybe the student didn't know they're supposed to check the ID band. It's kind of a teaching point. But we really are fostering here safety and professional responsibility. Very good, everyone. If you guessed C, awesome. Let's do a third question. Okay. A patient's wound dressing is saturated with blood, which means it's soaked. What should the nurse do first? So imagine you're walking into the room and you see their dressing or their bandage on them, right? And it's just saturated with blood. What do you think we're going to do first? Are we going to call the provider? Are we going to reinforce the dressing and check vital signs? Are we going to document the findings, or are we going to ask another nurse to look at it? Now, think like a nurse here because there are four options that all sound, some of them sound better than others. Maybe you're narrowing it down to two. So I want you to think about what do we do in nursing? Which emphasizes an assessment first? Think about us further assessing the situation. Now, if we call the provider, we don't really have enough information to tell him, right? Him or her. We need a little bit more information. So it can't be A. The goal here is stabilize the patient and gather more information and continue assessing before we do anything else. One more minute to give me a guess here in the chat. Excellent job. Everyone's guessing B, and you are absolutely correct. So it said reinforce the dressing and get vital signs. So the nursing process, had I mentioned before, right? We want to assess first before we notify anybody. So we want to find out, is my patient stable or not? Is their blood pressure, back to that first question we did, is their blood pressure stable? Are they losing a lot of blood? If we reinforce it and apply a little pressure, it's just going to prevent any further bleeding. Getting those vital signs is important because we need to know more, right? We need to gather more data. I always say to my students, like, we are little investigators. So, okay, I go into the room and it's bleeding. So why? Why is it bleeding? So let me go check their vital signs. Maybe their blood pressure is low and they're losing a lot of blood. So you always want to just gather more data. So when in doubt, pick the answer that's going to be an assessment and that you're gathering a little bit more data. Because when you call the physician, they're going to say, well, what are their vital signs? Are they stable? And you're really not going to know unless you gather this data. So, what this is all about is being proactive because we can't have the doctor make any decisions unless they have all the information. Don't overlook assessing before escalating. It really ensures that the patient needs are met efficiently and effectively. You guys are doing great. Excellent. So we understand why we have to reinforce and get vital signs. Perfect. Let's try another one. A patient refuses a medication and says, I don't want that pill today. What is the nurse's best action here? What is the best nursing action? So think to yourself, in this scenario, if you're taking care of a patient and they say to you, I just don't want that, what do you think is the best thing to do? Should we skip the dose? Should you B, educate on purpose and effects? Should you C, insist the patient take it? Or should you D, call the family? Now, I want you to think back to the first couple of slides I talked about, and I talked about what critical thinking is and how to critically think and kind of what those answers would be. So thinking about these options, if we skip the dose, then they're not going to receive their medications, right? Educating them is important because we really want to make sure that they understand why they're getting the medication. And that is a huge key role in nursing. Give you one more minute. Excellent job, everyone. You all absolutely got it correct. You want to educate and you want to make sure they understand the why, right? So the key point here is respecting autonomy. So the patient really has autonomy, meaning they have the right to refuse. But before you let them just say refuse, you want to just tell them everything. So let me give an example. If a patient wants to refuse a blood pressure medication, but their blood pressure is really high, I would say, okay, Mr. So or Mrs. So and so, your blood pressure is really high. This medication is going to lower it, which might help with your headache that you have. Um, and I would also explain how often they get it, what the dose is, the purpose of it, who prescribed it. And then what does this do? This respects their rights, but it also helps address any concerns. Oh, good point. So the patient might have insight into the meaning and the effect of the drug. Absolutely right. Someone saying, yes, you're absolutely right, because maybe they're like, well, I heard about this medication and I don't want to take it for whatever reason. So it's good to have that dialogue. What's important here too, everybody out there, I would document this, okay? Any conversation you have with a patient, you want to document it. You want to say exactly how the conversation went and what you said and what they said. So we can't force them to take anything. That violates their rights. And I like to think about this in such way that our patients are customers. We can't force anything on our customers. So education not only empowers the patient, but also strengthens, excuse me, the trust between you as a nurse and the patient. So you have that great relationship together. And then really, our patients will probably be a little bit more satisfied if we have that conversation with them because they're going to feel like they're heard, right? And instead of just dismissing them. So excellent job, everyone. You totally got that. Let's do our final practice question before I kind of wrap things up with some more tips. Okay, this is a little bit of a scenario. So remember that first question, we had two patients. Now we have four. So you have four patients to consider. They're kind of brief. So it's kind of, we don't have a lot of information, but let's just see what we have. So we have a COPD patient, which means chronic obstructive pulmonary disease. Their oxygen saturation is 89%. Sorry, it doesn't say on there, but it's on room air, meaning they don't have any oxygen on. The next patient is a post-op pain, 8 out of 10. So that means they just had surgery of some sort and they're complaining of pain and it's kind of bad, right? 8 out of 10. The third patient is calling you on the call bell because they're very, very nauseous and they want some medicine, let's just say. And then the fourth patient is going to be discharged very soon and you need to go in and do teaching. Wow. So all four of these patients need your attention right now, but you're only one. So think back to maybe some of those strategies I talked about earlier. Who do you think would be the most important person to see first? You want to focus on whatever the critical issue is first. Now, do all of them need you as the nurse? Absolutely. But which one is the highest priority? Which one do you think we should see first? Lots of good answers in the chat. Excellent. Yes. If you are thinking of our COPD patient with an oxygen saturation of 89%, you are absolutely correct. It is A, guys. Now, before I move on to the answer page, the post-op pain is important because pain is a priority, right? Pain is always a priority. But thinking back to what I mentioned in that maybe second question we did about airway, breathing, circulation. So, COPD, they have low oxygen, airway, breathing, circulation. In this scenario, oxygenation is crucial. An oxygenation saturation of 89% indicates compromised oxygen levels, which addresses immediately that safety and stability, right? I don't want this patient getting up out of bed if they're short of breath. I want to make sure they're breathing. What's going on? Why aren't they breathing like that? Now, some of you might be thinking, well, sometimes our COPD patients, chronic obstructive pulmonary disease patients, have lower oxygen levels. They can live at a lower oxygen level. While this is true, it's still important to go check on them first, right? Yeah, that's what someone's saying in the chat. It is expected. However, Let's say I haven't seen this patient yet before. If I haven't seen this patient yet before and I don't know their baseline, then I still want to go check on them first. Very good point. So let's say we go see them and their oxygen is always 89%. They're comfortable, they're not short of breath. Then my next priority would be the pain. Very good point, everybody. Awesome, awesome job. So making sure this client is stable first, that's the kind of the key here. We don't really know if they're stable. Very, very good. So, prioritization is a core aspect of not only pre-nursing with critical thinking, but also nursing. So really making sure we see the most critical patient first and make sure our clients are safe. So back to just how this would be scored in our entrance exams, like in HESI. There would be about 25 to 30 items. It would not be timed. Questions are weighted more difficult and they're worth a little bit more. And then typical program benchmarks 850 to 900. So more difficult questions are really going to carry more weight in your final score. And that's because they want you to tackle those challenging scenarios. So don't get discouraged if the question seems really hard. Um, and so when you're doing your entrance exams, you might want to ask your admissions advisor if this is part of it. So if they have a critical thinking section and kind of what those program benchmarks are. So finally, just to close everything out, you want some test taking strategies here, right? This is going to help you not only in pre-nursing, taking your TEAS and HESI, but also in nursing school and in nursing and taking your NCLEX. So, highlight keywords such as first, best, and initial. Those are keywords that are all about prioritization. So if it says first, who are you going to see first? What is the best action? Or who should I see initially? Or what should be the initial action? Think of it like that. Those are those words that are all about priority. Next, I want you to eliminate anything unsafe or anything that's like not nursing related. Anything that is passing the buck too. So like have a family member do it, have a friend do it, something like that. You want to kind of eliminate those answers because those are really not safe or not within the scope of nursing. Let's say you've done those two things. Now we're got to use something else. So we talked a lot today about airway, breathing, circulation. There's also something called Maslow's hierarchy of needs, and then the nursing process. Maslow's hierarchy of needs, we concentrate on our physiological stuff first, then on to safety, and then so on. So making sure someone's physiological needs are met first, and then seeing if it's a safety issue, and then kind of taking it from there. Nursing process, we did talk about a little bit today too, and that means that we want to assess first. We want to gather more data. We want to get the assessment. These are really basic frameworks, but they're gonna help you, especially if you have any tiebreakers, right? If you're between two answers, kind of think of these. And then this last one, I want you to practice with rationales, not just scores. I want you to understand the why behind each answer when you're thinking about critical thinking, okay? So a good rule of thumb is when you spend about 1 minute on a question, you spend 2 minutes on the rationale and understanding the why. For instance, if you spent a minute answering one of our questions today, I would spend 2 minutes going to review some notes on something or understanding the why behind something. And then if you need to review something again, go to a video or a worksheet or a cheat sheet. And even if you teach someone else, that's really high level thinking. But basically, these strategies are going to help you, okay? Not only in critical thinking, but like I said, kind of everywhere in practice. So to close out, I just want to talk about what critical thinking is. It grows with practice, okay? You're going to get better and better the more you practice. Just like in nursing, each scenario encounter is going to be an opportunity to enhance your problem solving skills. Because I like to think about this like a muscle. So we want to flex that muscle, right? And enhance that skill. It's because we're just building the strength of our nursing brain. Each time you take a test, each time you do a practice question, you're becoming more confident in your decision making, and especially in those high pressure situations when all eyes are on you, right? When you're out there in clinicals or out there as a nurse, you have to make decisions and you have to make them quick. Embrace every experience And watch your skills just get better and better the more and more you practice. Awesome job, everyone. If you have any questions, I have a moment to answer. Otherwise, I want to say you did a great job. Critical thinking is super important in nursing. All right, everyone. If there's no questions, have a great rest of your day. Awesome job. Keep studying. My words of advice for any of you out there taking tests soon is dress your best to feel your best, okay? Wear your favorite outfit. That's always going to be my advice. And maybe eat your favorite breakfast or some sort of snack because you're just going to feel better. All right, everyone. Have a great rest of your day.